Guys, I have discussion E for you. We're discussing family nurse practitioners. Okay, so that for elderly sake, that falls under healthy aging for me. So here we go with tonight's presentation. Family nurse practitioners. Family nurse practitioners, FNPs, are frontline primary care providers who expand access, deliver holistic, patient centered care, and help stabilize strained health systems, especially in underserved and rural areas, communities. Overview of the role. Family nurse practitioners are advanced practice registered nurses trained to provide comprehensive primary care access, the lifespan. They diagnose, treat, manage chronic conditions, prescribe medications, and emphasize prevention and continuity of care, positioning them as essential primary care clinicians in modern health systems. Expanding access and filling gaps. A central way FNPs shape healthcare is by addressing primary care shortages and improving geographic and social economic access. Health systems increasingly rely on FNPs to staff clinics, community health centers, and telehealth services, which reduces wait times and brings routine care closer to patients who otherwise face barriers to seeing physicians. Clinical approach and patient experience. FNPs combine clinical assessment with holistic patient centered care model that prioritizes education, prevention, and long term relationships. This approach often leads to better chronic disease management, higher patient satisfaction because FMPs integrate lifestyle counseling, mental health screening, and care coordination into routine visits. Education scope and practice settings. Becoming an FNP requires advanced graduate education and clinical training, typically at the master's or doctorate level, plus national certification and state licensure. FNPs practice in diverse settings: primary care offices, urgent care, schools, long term care, and private practice, and their scope of practice varies by state and employer, influencing how independently they can prescribe and manage care. System level impact and outcomes. Reach and reporting show that FNPs improve access while maintaining quality and cost effectiveness. They can reduce unnecessary emergency visits, manage common acute and chronic conditions effectively, and support preventative care initiatives. Health systems that integrate FNPs often see gains in thorough output, throughput, and patient continuity without sacrificing clinical outcomes. Challenges and future directions. Despite clear benefits, FNPs face regulatory variability, scope of practice limits, and workforce distribution challenges. That can blunt their impact. Ongoing trends shaping their future include broader telehealth adoption, team-based care models, and policy shifts that may expand independent practice in some regions to maximize their role. Stockholders must align education, licensing, and reimbursement policies while investing in interprofessional collaboration and technology that amplifies FNP's reach. Key takeaways. FNPs are versatile, cost-effective primary care providers whose combination of clinical skill and holistic practice is reshaping access and outcomes in modern healthcare. But realizing their full potential requires coordinated policy and system changes. Okay, folks, so that is your shows for the night. I'll be back on tomorrow for shows. For now, Gator Wellness. Take care, folks.